Senator Siewert.
Thank you, Mr President. My question is to the Minister representing the Minister for Health and Ageing, Senator Ludwig. The Minister for Health and Ageing recently appointed Mr Barry Williams of the Lone Fathers Association as one of the ambassadors for the National Men's Health Policy. I note that in 1999 the current Minister for the Status of Women, Tanya Plibersek, expressed serious concerns about the Lone Fathers Association. She described them as an extreme group and said, "Remember that this is the group that refuses to believe that women experience domestic violence more often than men." And when, as Prime Ministers, both Bob Hawke and Paul Keating refused to meet with Barry Williams, Minister Plibersek then stated that she was proud to belong to the ALP because it refused to deal with extreme groups such as the Lone Fathers Association. What evidence does the government have that the Lone Fathers Association has changed its stance on the issues of domestic violence and the rights of women? And what does the government believe does the government believe it is appropriate for a person holding such views to be an ambassador for the National Men's Health Policy?
Minister representing the Minister for Health and Ageing, Senator Ludwig.
Thank you. I thank Senator Siewert for her question. And I think it is important that we raise the issue of men's health. Men, unfortunately, don't live as long as women, and they die at higher rates from coronary heart disease, stroke, vascular disease, suicide and traffic accidents and injury. And development of the first national men's health policy for Australia is a significant step in improving the health of Australian men. We have appointed 5 men health ambassadors who will be a focus point for awareness raising. They will help with our community forums and talk to men about men's health issues. We will be appointing more. They will be from a range of professions because the aim is to have a cross-sample of Australian population capable of representing a wide range of men's issues. These ambassadors don't necessarily have expertise or specific knowledge of men's health issues. Rather, they will bring together other skills such as the public profile and ability to talk to men about issues that affect men. The ambassadors are engaged on a voluntary basis, and aside from their travel, accommodation and associated expenses, they will not be paid. The government, of course, has and will provide the estimate of expenses of around $250,000. But of course, these funds will be spent on getting ordinary men together to talk about men's health. The government, of course, when we talk about the consultative process, we will have a look at all of those issues that you did raise, and I'm not aware of the specific issues that you raised in respect of Mr Williams. However, as this government has made it clear, not all will necessarily share every view of every ambassador on every issue, but I will take those issues and
Senator Siewert.
Thank you. I further note that Barry Williams, on behalf of the Lone Fathers Association, signed an international petition opposing the UN report on violence against women, a petition which described the UN report as ideologically anti-male and included the following statement: "The result of such domestic violence programs has been to weaken families, bias divorce proceedings and deprive children of contact with their fathers," and that the Lone Fathers Association recommends that all men entering a permanent relationship should insist upon a prenuptial arrangement, stating, "Remember, if she is not prepared to sign such an agreement, there must be a hidden agenda." Does the government believe it is appropriate that a person representing an organisation with views that are openly hostile to women should be an ambassador for the nation's men's health policy? When offering him this senior, high-profile position, did the minister ask Barry Williams if he repudiates the views of the organisation of which he is president, and if not, will the minister remove him from this position?
The Minister.
Thank you, Mr President. I thank Senator Siewert for her question. As I said in respect of the first question that you asked, and it applies applicably to this one as well, that I'm not aware of the individual comments that you have raised. I have indicated that I will seek to raise those with the Minister for Health and ask her to examine those particular comments. I will say more broadly, though, in terms of the issues which surround this particular matter, the Minister did make it clear that those views that were expressed, and this is going back to those ones that I think started the issue, made it clear that there were extremely offensive statements made by two recently appointed ambassadors for men's health, which were drawn to her attention. Those views were abhorrent in her view and in mine as well, and the minister immediately sought an explanation from those
Order.
two
Your
persons.
time has expired. Senator Siewert.
I note that this particular person who's been appointed as the ambassador has made blatantly anti-gay comments, has made comments about opposing domestic or on comments around domestic violence and anti-women comments. I ask and I mention that the Minister for Health and Ageing has publicly accepted responsibility for the appointment of this particular ambassador. And can the minister explain what selection criteria are used to appoint these ambassadors if these three specific issues got through that selection process?
The Minister.
Thank you. As I was saying in response to the second supplementary and now the first supplementary and the second, the minister, of course, made her position quite clear, and I think I joined in that, and she took full responsibility, as I think Senator Siewert has said. Men's health is an area that has always received insufficient attention, and the minister will continue to engage, as is the government, with men from all walks of life with widely divergent worldviews and backgrounds. This will inevitably mean that the government will not necessarily share every view of every ambassador on each issue.
Resume your seat. Senator Bob Brown.
The question wasn't about the process from here on. It was about the process of selection, and the minister should address that.
Senator Ludwig, you have 22 seconds left to answer the question. Senator Ludwig.
Thank you. And as I was going on to say, that the way that these, of course, will be dealt with is that, of course, they will be selected from all walks of life, and the ambassadors, of course, are not appointed to provide expert advice to government, but to engage men in looking after their health, being prepared to talk to men about problems and encourage them to seek help.
Your time has expired.